We are all so busy these days, and we're always looking for helpful tips and advice on how to find a better work-life balance. We all have to earn a living and pay the bills, but are you doing enough to look after yourself and your health at the same time? Now, many of us prioritise careers and work, and we're slaving over our computers and mobiles all the time. But does this make you cut corners on your diet, exercise or sleep? I'm Dr Ben Sinclair, and welcome to Health versus Wealth with Dr Ben. Our guests share their life experiences and we discuss their challenges in their health and their wealth. I hope their experiences will help you with your life and health. My guest today is remarkable Dr. Qian Xu, who specialises in skin rejuvenation and health optimisation. She's medical director at Clinicity in central London, which I should say, in the interest of transparency, we at the Dr. Finlay's private practice use as our London base because it's just off Oxford Street. Dr. Qian came to the UK from her native China as a child and has some fascinating insights and views on the differences between Western and Chinese medicine, and we'll get into that discussion in a moment. But first, a warm welcome, Qian. And how old were you when you came to the UK, and were your parents in medicine?
Hello, Ben. Thank you for having me here today. Really honoured. So I was born in China, mainland China, and I came to the UK at the age of 10. So my parents came over to the UK first for the purpose of work, and then I followed them soon after.
And were your parents in the medical business?
My mum was a doctor specialising in women's health and delivering babies in China. My father qualified as a doctor but went into clinical research, so he never worked in the hospitals, but he went into research, so working in the labs and things.
And tell us a bit about what drew you into medicine.
Well, science was always a subject that I was very good at, very interested in school, and given kind of the quite medical background that my parents came from, I naturally was drawn to it. And also at that age, when I had to decide what to do for a career, I wasn't really aware of a lot of options. Just medicine was the obvious thing for me to go into, really.
So at 16, I believe you decided to study medicine, and you chose the city of Southampton, which played a very important part in your life. Why was that?
Well, I mean, for me, going to university was a big thing because, because I came to the UK at the age of 10, I had to learn English from scratch, and everything was a struggle. And just, getting into university to study medicine was a big deal for me because I actually didn't get in the first time round. I had to go through clearing. So
that makes two of us, by the way. I got in on the third attempt, so I think the best doctors get in at having demonstrated that resilience.
I mean, it's just important thing is just not to give up, just keep trying, right? So I got there in the end. So I think, I managed to get into Southampton, but wherever I went, it would have been a really good thing. But I was in Southampton for 6 years for my medical degree, and then my first hospital job was also based at Southampton for the first 3 years of my medical career. So I lived there for a long time and was kind of quite established there. And then my next big move was to London. So then that was about 12 years ago. I moved to London, and I've been there ever since.
Wow. Now, tell us about your decision to specialise, because I think I'm right in saying you thought about becoming a surgeon.
Yeah, so I've always been quite good at arts and crafts. I was very good with procedures and very good with my hands, and surgery was something that naturally I thought I'd be really good at. And the other thing that drew me to it was the problem-solving aspect of it. I like to be able to go in, cut something out, treat a problem and then be done with it, rather than having this kind of really chronic problems and relying on medicines to treat something. So surgery was very appealing at that point.
And you're not a career surgeon now, so what happened?
So obviously when you're a bit younger, what you'd like to do ideally as a career based on what you're good at is one thing, but then actually going down that career path, there are other factors that come into play. So, training to be a surgeon and then to go all the way to become a consultant is very tough. Whichever country you're in, doing that is very tough, but particularly for me, at that point, I had just got married and I just decided that actually I didn't want to make all those sacrifices in my personal life to chase after this career, because my lifestyle, what I wanted from life, which was kids, family, that was a lot more important to me. And there was no way that I could train to be a surgeon full-time and have the life that I wanted. So I decided to leave surgery and pursue something else.
It's a really interesting balance you've talked about there. The show is called Health versus Wealth with Dr. Ben, and here you are demonstrating that choice of career, but also, you want to build social wealth through your family. You want to have that family experience just as important as the career. And how do you balance those things up is really hard. On the outside, people might think, oh yes, become a surgeon, it's the best thing to do. But actually, a lot of surgeons really struggle with that. And so it took you in a different direction. So where did you go next?
So I actually, before I decided to hand in my notice, I'd already started in my head to plan what I would do if I were to leave. I kind of wanted to have a backup plan before I just handed my notice. And it was around that time I was speaking to various people, trying to work out what I could do, what I wanted to do. And I basically decided, for me, it was really important to do something to make use of my skills, my sort of procedural skills, do something practical with my hands. And I wanted to ideally do something that was maybe outside of the NHS, which at that time was quite a scary or quite a bold thing to want to do. Not many people around me were talking about it, but I guess I've always had this sort of entrepreneurial spirit. I never really wanted to follow in other people's footsteps. So I kind of looked into it, and the idea of doing aesthetics training was something that, through all my chats with different people, it came up in one of the conversations. I didn't think about it too much at the time because it was never something that I personally was interested in, but then it got, it was stuck in my head, and it just kept on coming up. And then I looked into it more, found out what was involved. And then I thought, actually, this could be something that I'm really good at. At that time, it was about doing the anti-wrinkle injections and the dermal fillers. And that 12 years ago was quite a taboo thing. Again, not many people were doing it. But I looked into the course, then I booked onto a course. And once that was booked, I handed in my notice from my surgical training. And it was quite a difficult decision at the time. I got a lot of stick from my family, because in the Chinese culture, it was kind of quite frowned upon to quit from such a prestigious job and a kind of training opportunity. So my parents couldn't understand it at the time, and they weren't very happy with me doing that.
Wow.
But I just had to really decide what was important for me and just do the right thing for me.
And you're now medical director of a beautiful clinic in London, which we love working out of. Do your parents see the benefit of your career path now? Do you feel like they have seen where you've come to now?
Oh, absolutely. I mean, they weren't annoyed at me for that long, because obviously I subsequently had proven to myself and to them that actually I was much happier once I left surgery, because then other opportunities came along. It freed me up to do other things and develop my own business. And it's not in the Chinese culture to praise, but they have recently learnt to be more positive, and they are very proud of me, even if they don't say it.
That's lovely. It's an interesting balance, because what we're talking about is the cultural differences here between a Western view and a Chinese or more of an Eastern view, and that all feeds into what you're developing at Clinicity, which is also why I was really excited to become a part of that provision in London. Tell me about the view that you have on the differences between sort of Western pharmaceutical medicine and Chinese medicine.
I don't know how to put this succinctly, but basically the idea of Chinese medicine and not only Chinese medicine, but in the kind of integrative medicine or functional medicine, which is better known in the West. It's all about taking a more holistic approach, because we humans, we're made up of different organ systems, and every system has to work well together. So, the idea of, like, the traditional idea of the family doctor, the GP, is meant to be very holistic, and you can treat the whole person. And even the hospital, the general physicians were trained to treat the whole person. But gradually, as modern Western medicine's developed, it's become increasingly specialised and subspecialised. And that was what I didn't like about medicine, because how can you make the right decisions about how to treat someone if you only know about their heart or their lungs or their gut? Whereas in the Chinese medicine, even though I was never trained in Chinese medicine, but I have been exposed to it through work, through personal interest, and just that sort of culturally as well. It is all about looking at the whole person, the whole body, and the energies and the other factors that's contributing, and trying to treat things at the root cause rather than just treating a symptom.
Exactly. And how is that related to your skin rejuvenation work that you do at Clinicity now?
The work that I do now has really been shaped over the last 10 years or so through kind of a bit of trial and error, and the new things that I've learnt along the way, with very much influenced by people that I've met along the way, and I've gradually become a lot more holistic. And also coming through the pandemic as well, I've struggled with my own health issues through the pandemic, with COVID, long COVID, and just realising the importance of health in all of this, that I cannot treat the skin in isolation, because there's so many things that affect the skin. So in order to give my clients, my patients, the best results, we have to be more holistic. So I now do look at everything, every aspect, because all of that can be related or can affect their skin health.
Welcome back to Health versus Wealth with Dr. Ben. I'm with Dr. Qian Xu, who's a renowned skin rejuvenation specialist at Clinicity in London, where Dr. Finlay is also based. Now, we are talking about the differences between Western view and a sort of a Chinese holistic view in health and medicine. In a Western pharmaceutical view, I think we've become a bit narrow. So do you feel that we need to broaden out and have a more holistic approach?
Definitely. I mean, this is something that I've really been trying to push for as long as I remember, really. I remember when I was at university training to be a doctor, that one of the first assignments I did was writing about a piece about preventive medicine. So, that was 20 years ago now. And even now, I think it's even more important. And when I work in the hospital in A&E, there is no time to take this holistic approach. And also in our training, I don't think it was emphasized enough that we need to be more holistic. So it's very much about quick fixes, someone coming in pain, first thing we do is giving them painkillers before we even ask any questions.
I feel the same in general practice. I've seen it change over the time of my training and my career. I think before about 2005, I did feel like as a GP I had time to have those lifestyle interventions, to ask the deeper questions, to go deep, to understand the whole family structure, see where the tensions were, and treat the whole person. And then after that, it just got shoehorned into this 10-minute, you've got 2 minutes to examine, 2 minutes to question, 2 minutes to write up your notes and formulate a plan, 2 minutes to sort of summarize back to the patient, and then they're out, and then the next one's in. And so I think we're really suffering from time with patients to deliver that holistic, integrated view. And I suppose that's probably pushed us both into the private sector, because people have more time in that sector, or they choose to give themselves more time as patients.
Yeah, definitely. In the NHS, I mean, not just myself, but a lot of my colleagues who are still working in the NHS, they feel like they are unable to give the kind of care that they want to give to patients. And that's quite sad, and it's quite sort of disheartening for those doctors, nurses who want to do the best. In the private sector, we do have more time, and the people who come to see me who have got the financial abilities to be able to see me privately for various things, yes, they benefit from that. I just wish I could help more people, expand that out to more people.
And it's really hard, isn't it? How do you balance this need for greater awareness, prevention, tailoring? So many research papers talk about that medication or that the health experience needs to be tailored to the patient, and yet we can't deliver that in the government structure. I'm really intrigued, therefore, to know, in your private practice, in your skin rejuvenation clinic, what sort of things do you tailor to people to help them to get better skin?
So the way that I do my skin rejuvenation consultations is very much a medical model, right? So when I was initially trained, it was all about, these are the procedures we do, and people come to have the anti-wrinkle injections, for example. They ask for something and then I deliver it, and that's it. A very transactional approach. And then very quickly, actually, I realized that didn't work for me. I didn't like doing that. So what I do now in my consultations, I spend a good 45 minutes at least, take a proper history. And so where skin rejuvenation is concerned, it's the skin history, what the problems are, what has led to that point, what they've done about it, and where they'd like to get to, very much a medical model. And then based on that, I go through my 3 steps, where I talk about step 1 is kind of their initial preventative stuff. That's like getting the skincare right, for example. Step 2 is about doing some treatments for the skin to give the skin a boost. That's kind of the acute treatment bit for the skin. And step 3 is where I talk about some of the injectable treatments that might be beneficial within their treatment plan. But I personally believe that we shouldn't just be relying on those injectable treatments. They are kind of the icing on the cake. If you don't get the basics right, you're not going to have healthy skin. So it doesn't matter if you're wrinkleless, because the skin's not going to look great. So that's very much my approach now, and obviously I'm adding in that health element, so through the history part of it. Some people might mention medical issues, or they might be really stressed at work, for example. Their diet might have gone off. All those things will contribute to their skin health. So now I will look at and address all of those other issues as well.
It's great to see you're doing a holistic approach to the skin. I've always thought the skin is just a reflection of how healthy the rest of the body is often. And so if you have healthy skin, it's likely that the rest of your body is in reasonable good health, at least in good nutrition or perhaps in good balance. And if we have problems with our skin, often there's an underlying gut problem or a nutritional deficiency or an imbalance.
Or a sleep issue.
Those
bags under the eyes.
Exactly. So we come back to almost this sort of ancestral medicine of looking at the kind of the basics first. And, in the old days, you used to stick your tongue out, take the pulse, look the person in the eye, and those things told you a lot about their general health. We've kind of veered away from that towards tests as the only thing that might tell us. And it's good to hear that you're still doing the basics well, because those things, and then you can add on that. I know you have some interesting devices at the clinic in Clinicity. One of our previous podcast guests was James Carroll, who created the Nova Thor red light machine, and he's the CEO of Thor Laser Company. And I've personally experienced the red light therapy, which I love, at Clinicity. Can you tell me a bit more about those other things that you're doing, more broadly for people's health at Clinicity?
Sure. So let's start with the Nova Thor. So red light therapy is also known as photobiomodulation. So it uses the power of specific wavelength of light to improve our health in certain ways. And it's my favourite toy, because I can't really call it a toy. It is actually a medical device, because it has really helped me through a lot of my health issues, and it's helped a lot of our clients achieve better health through regular treatments of photobiomodulation. And we've had the machine for 3 years now. We got the machine just during the pandemic, and it was after I had long COVID myself. So it really helped me to get better from that. And then as a sort of unexpected benefits from it, other things that I noticed, like my hair growing much more healthily, thickening up, and my exercise capacity improved, and I was started to sleep better, and my hay fever symptoms improved. And all these things, I kind of noticed gradually over time, I wasn't doing anything else different. So the only thing that I could put it down to was red light therapy.
That's really interesting. I hadn't heard that hair growth could be improved, but I guess if it's all about skin perfusion, about blood flow, reducing inflammation, for the listener, photobiomodulation helps the mitochondria in our cells to achieve a better balance of a sort of a healing state and recovery and boost energy. So actually all those things you just mentioned, it makes a lot of sense that they got better.
Yeah, and it wasn't something that I initially thought about. But for me, all those, like the hair thinning, all of that happened after COVID, after long COVID. And at the time, it wasn't very well known. And the fatigue and everything as well. So I feel like with the red light therapy, and, we can't look at these in isolation, but in the context of generally living a healthy lifestyle, making sure my diet is balanced, doing the right amount of exercise, all of those things have led to me actually now turning 40 this year, but feeling I'm at my best, in my best state, probably fitter and more healthy than I was in my 20s.
That's great to hear, and it's a testament to you living out the principles of your lifestyle. And by the way, I did hear a research study about the Thor laser machine was actually that in chronic fatigue conditions like CFS, if you have a set number of treatments, red light therapy, over an intensive 6-week period, the benefits are measurable 6 months later. So it's actually a significant impact on well-being and on function. It's not just a sunbed. It actually has some research behind it, which is quite exciting to hear.
Yeah, definitely.
And I know they're doing more research on wider things. I'm really excited to use it for my long COVID patients, and I'm using it myself when I come down at the end of a long clinic day.
And actually your patients who you have referred to us for red light therapy, I regularly check in with them, see how they're doing, and they're all reporting really positive outcomes from it. So it's very encouraging. It's
good, and it's such a fantastic tool to have, but you've got to have the space to have it, and it's great to have that in central London. We're talking more personal now. Have you experienced skin problems yourself? Did that get you into the area of skin health?
Yeah, so at the beginning of my sort of career in my sort of skin rejuvenation side of things, it was through having my own skin issues that led me to kind of find out more and learn more about skin health. Because as doctors, the way that we're trained, there's certain things they don't really train us in, and a lot of sort of lay people think that we can deal with anything, but that's just not the case. And even though dermatologists in this country are trained about skin diseases, and when there's severe acne, for example, then they will treat it with medicines, but they don't really get trained on skin health and how to maintain skin health. And I think that was the issue, really. So in my late 20s, I had this rash that just came out of nowhere. I didn't understand what it was. I thought it was acne. When it got really bad, put some steroid creams on it, settled it for a few days, but the moment I stop, it would come back, and it was awful. And I think if you don't have skin problems yourself, it can be hard to imagine what that would feel like to suddenly have your face full of rash. It really has a massive negative impact on your confidence. And no matter how much you say, I don't care about what people think, people do care, and I did care.
And it hurts as well, because you can feel it, can't you?
Yeah, it can hurt, irritates, and then I was trying to cover it up with concealer, and it was just, when I had meetings with people, all I could think about was they're looking at my rash. So having gone through that experience, I can relate to my clients who come to me. It might be a small spot to me, but to them, they're going through it. It's a big problem. It's a big issue. So I'm a lot more, I can really relate to them. And so while I was having those problems, that was at the same time I was learning to do the injectable treatments. And I just found that doing those treatments, it wasn't as rewarding. And the moment I learnt more about medical grade skincare and skin health, and I tried those products on myself, gradually got my skin better, I just thought, wow, this is what I want to do, because I experienced that confidence boost when I got my healthy skin back.
It's so good when you've got that personal experience, and I think it really it shines through, and then people want to find out how you did it, and and you can help them too. So nothing can take away that personal experience as a patient and as a clinician. It's a very powerful tool. Let's talk more about yourself. You are, a medical director of a busy London clinic. You are pushing forward the boundaries. What impact does that have on your own health? How do you manage your health? How's the balance going at the moment?
So I think the word balance, some people think that it is kind of static the whole time. When your life is in balance, it should just be the same.
I think it's more like a seesaw, isn't it? Most of the time.
It's an oscillation.
Yes,
it's like a pendulum, right? So the balance is right in the middle when you're completely balanced, but no one can stay there all the time. So my life now, it swings from side to side and it passes this kind of absolute balance in the middle. I think the key is that you have something that kind of keeps you centered, that pulls you back if you go a bit too far one way or the other. I think one of the main reasons I'm developing the business in the area of health and health optimization is because it keeps me healthy myself, because I always like to practice what I preach. Everything that I talk about, I do myself as well. So I try my hardest really to come back to the center when I feel a bit stressed out.
It's really important to say we might know a lot of stuff, but we're not perfect ourselves, and we're all human beings, aren't we? So I think it's really important not to be put on a pedestal and say, I'm an expert in this and therefore I must be perfect. I know I'm not. My diet slips, my exercise routine slips, I do too much work, I don't get enough sleep. But as you say, you try to bring it back to that center. What do you feel it is that brings you back to that sort of center?
It's my kids. Because at the end of the day, the reason that I'm doing all these things is because I want to get the most out of my time with my kids. I want to be able to run around with them in the park, playing going trampolining with them, take them skiing. I'm quite active and I want to be able to do all those things. And to do those things, I have to stay fit and healthy myself.
That is a great motivation, isn't it? To stay healthy so that you can be there for them and be an active mum. What barriers do you feel are there in your current lifestyle to getting enough sleep at the moment, let's say?
Well, often it's the amount of work I have to get done. We all have 24 hours in the day. Sometimes it just feels like I need 48 hours in the day, because I'm sure you know what it's like when there's just so much to be done. And like you said, no one is perfect, and I'm definitely not perfect. And the thing that will suffer is usually my sleep. And quite often I will sleep for like 4 or 5 hours a night.
What about the nighttime quality of sleep? Are there any things there you think you could do to get some better deep quality sleep at the nighttime?
I think my sleep quality is actually really good. I fall asleep quite quickly, and I tend to stay asleep until my alarm goes off in the morning. I don't tend to wake up in the night. And I think through all these years of working A&E shifts, I've trained myself to pretty much fall asleep. I can fall asleep anywhere, anytime. My head hits a pillow and I fall asleep. It's a real skill, I think, that I've picked up.
We have to learn it. It's the necessity is a mother invention with that regard. It's been so fascinating talking to you, but we've run out of time. So I want to thank you for coming in today. And
thank you for having me.
It's been a great chat. Thank you. So that's it for today. I hope my guest and I have helped you meet some of your health versus wealth challenges. Now, to hear more from me, Dr. Ben, why not subscribe on your usual podcast platform? And if you like my advice or you'd like to be a guest on the show, you can email me on podcast@drfinlays.co.uk. Anyway, I hope to see you again, but for now, it's goodbye from me, Dr. Ben.